My name is Dr. Wolfe. I'm the lung specialist here at Watauga Medical Center. And as a physician, we have a lot of different conversations with family and patients here at the hospital. And I think that if I think about the good conversations that I have, the good conversations are always about the patient getting better. For example, we may have a patient who comes to the emergency department with abdominal pains. They get some x-rays, some blood work done. They've got appendicitis, or maybe they've got an infected gallbladder. They're whisked off to the operating room, and a few hours later, the surgeon comes back and talks to the family members and says, "We found out what was wrong. We took care of it, and in a few days after recovery, your loved one's going to go home with you." Or maybe the patient comes to the hospital because they can't breathe, they're having chest pains, they have an EKG performed, and it looks like they're having a heart attack. So you call the cardiologist, and the patient is taken to the cardiac catheterization laboratory, and they're found to have a blockage. And a couple hours later, the cardiologist comes out and talks to the family and says, "There was a blockage of one of the blood vessels around the heart. We were able to open that blood vessel up, and your loved one's going to be okay. And in a day or two, they'll be able to go home and recover fully." Contrast those conversations to the conversations that we have to have with many of the families who have family members who are hospitalized with COVID infection. These conversations are often on a different matter and a different tone altogether. These patients have come into the hospital with respiratory problems, and they wind up on life support. They wind up on breathing machines because they can't breathe on their own. They wind up with chest tubes between their ribs because their lungs have collapsed and we have to get their lungs re-expanded again. And they wind up on medications and solutions that help support their blood pressure, because without these medications, these patients would die from shock. And this goes on for days, sometimes weeks, and for others, often longer than that. And despite the heroic efforts of the nurses and the therapists and the physicians involved, sometimes it's just not enough. And eventually, these people who have been sedated because they're on all of this equipment and they can't really speak with their friends or their families on a spontaneous way. And these people have feeding tubes that are giving them the nutrition that goes in a tube from the mouth down into the stomach, because they can't do it on their own. There comes a point in time where sometimes everything that we did just wasn't enough. And eventually the physician has to go out and talk to the family, and the conversation usually starts like this: "I'm sorry. There's nothing else that we can do. All of the treatable things have been treated. All of the fixable things have been fixed. We just can't get enough oxygen into your patient's lungs. And despite what we do, the inflammation from the virus has overwhelmed the body, and they don't have much longer to live." That's a horrible conversation to have with the family. And yet we have to do this on a daily basis almost. And this conversation, if that conversation isn't bad enough, then we have to talk about how are we going to keep this patient comfortable. How are we going to keep this patient as pain-free as possible during the final moments of their life here on this earth? And during those final moments, we're removing the very equipment that kept them alive for so long. It's a tough situation. And it's a tough conversation. And yet, we deal with this in the intensive care unit day in and day out. So the best solution is to not get the virus. And for many of you out there, the best way to accommodate that is to get the vaccination. Thank you.